Namaskar. I am Dr. Rajshankar Ghosh, Senior Advisor with the Vaccine Delivery Team at the India Country Office of Bill and Melinda Gates Foundation. Today I am here in the state of Madhya Pradesh and I'll be speaking to Madam Priyanka Das, who is the Mission Director of National Health Mission, Government of Madhya Pradesh. Madhya Pradesh has actually held an exemplary COVID vaccination program in the country. And here today we will hear from her about how the state had planned and executed this program. When the COVID broke out in India in 2020 and then again in 2021 when there was a massive outbreak, Madhya Pradesh had large number of cases, but with a large vaccination and wonderful control measures in place, the state has been able to tackle this menace of COVID virus with a very good kind of control measure. So what I would like to begin with is, Madam, can you please tell me as to how you planned and executed the COVID vaccination program in the state?
As you're already aware that Madhya Pradesh is a fairly large state, but in Madhya Pradesh from the very beginning we realized the value and importance of COVID vaccination, and our Chief Minister has actually led the program from the front. He has in a way been the brand ambassador of COVID vaccination in the entire state. So one was generating sufficient awareness so as to dispel myths, to avoid vaccine hesitancy. So there was continuous work on that front. But secondly, and which is far more important, is that there was meticulous planning. When I say planning, we do not only mean logistic planning as to how the vaccines will come and it will get delivered to our 52 districts, some of which are tribal, some of which are forested, some of which are in ravine lands. Second thing is, how do we plan the HR, how do we train them, how many sessions do we plan, how we bring the people to the sessions, to the centers. So planning happened on actually 3 to 4 fronts: infrastructure planning, logistic planning, manpower planning, training planning, and finally the COVID portal. The work happened in these 2 fronts, and when it comes to actually leading the entire COVID vaccination program, here at the National Health Mission we actually have a vaccination control and command room through which we factor in the number of population, the kind of uptake of the vaccine that will happen, how the gender breakup of the districts, and then we start the supply, see the level of manpower that is required, how to break up some sessions into mobile teams. So these kind of very micro planning happens from the NHM office here, and however planning being done from the centralized level, execution is done in a very decentralized manner. Our collectors in the districts have led the vaccination campaign from the front, and in Madhya Pradesh we have followed the Jan Bhagidari model, and we actually have district level crisis management committees, block level crisis management committees, and village level crisis management committees. So these committees do not just have officers and political representatives, but it also has people from the civil society, the religious leaders, the community leaders, people who can influence people, and so taking actually everybody on board, we've led the vaccination campaign in the state.
That is fantastic, because as I'm speaking to various leaders who have really led the vaccination program from the front, one thing is very clear about Madhya Pradesh, that you have followed the most important principle of public health, which is a people-centric program. The people-centric program is going to go a long way in terms of building the confidence of people, not only in COVID vaccination, but in your future programs. Now, one of the things that has happened is that in Madhya Pradesh, the coverage of the first dose is exceptionally high. You are one of the top performing states in the country. Now, in general, what we have seen anywhere in the globe is that where we have very high coverage, equity gets masked, that is camouflaged, and there are pockets in which populations do not receive. Madhya Pradesh has one of the most diverse populations in the country in terms of the tribal population, which I heard is about 20% in the state. 80% of the state lives in the rural area. So I would like to hear from you about how you addressed equity in terms of gender, in terms of the geography and in terms of also some of the economically weaker sections. So would you please talk?
So I think it's an excellent question, and we in Madhya Pradesh are very proud of the fact that when we have led the vaccination campaign, we have actually factored everybody in. We follow the principle of the last person standing in our day-to-day governance. Our CM always keeps talking about the last person in the queue should get the benefit. So that has somehow filtered in to our vaccination program as well. But as you rightly said, there's no doubt Madhya Pradesh has geographical diversity, but as such it also has cultural diversity. So the problems of, say, Mahakaushal area, which comprises of forested and tribal region, is totally different from Bundelkhand area, which has a lot of migrant issues, a different kind of hesitancy. And similarly, the urban areas again have a different sort of challenge. There's a lot of fleeting population, there's a lot of tourist population, there are industrial hubs where we have to cater to and see that even the worker who has come in or who is working there gets the vaccination. So when we plan for the districts, we obviously see gender. And on gender, I want to speak to you separately as well. But we have also factored in, age cohorts. So we wanted to see that even our 60 plus population, which is supposed to be a vulnerable category, gets covered. For that, we took in, help from the social justice department. We targeted the old age homes, all the different civil societal institutions which run these kind of institutions, care shelters. We have also, factored in the mental health institutions where we have, in Gwalior and Indore, we have 2 institutions. We also ensured that even they get their COVID vaccinations and both the shots. And when it comes to industrial areas, we also have a mechanism in MP wherein we have, regional industrial associations, district level industrial associations. So we brought in the industry partners on board. We said that we are open to, going into your campuses and housing the vaccination centers. So all the companies were very happy and they played a proactive role. Some of the organizations have 3 shifts in which manufacturing happens. So we planned our manpower of vaccination in 3 shifts so that the labor, while he is coming in or going out, he gets his shot and he goes back home. He doesn't have to come in additionally. So we factored in the ease and the comfort of our people. We prioritized that over everybody. Secondly, when it comes to women, definitely in the initial run we found that uptake was a bit low, and we were not matching the general sex ratio which is there of the population. So we were down by, say, 3 to 4%. We were always lagging behind. And what we also realized is that one reason why this is not happening is we are not proactively talking to our pregnant women. And when it comes to pregnant women, things get a little bit more sensitive because you are talking about not just one life, you're talking about 2 lives, and there were a lot of myths and hesitancy. But what we did is we were very transparent. We ran a very rigorous awareness campaign, and we were not shy of opening up our centers. Right. Initially we had a very cautious approach of doing it only at very high level institutions, but when we moved slowly, when we saw that after vaccinating 1.5 lakh women safely without a single case of AEFI, then we gradually opened up. We allowed that even our CHCs and PHCs administer those shots. Then when we crossed the 2 lakh mark, we got a little bit more confident, and then we said that we have our CHOs. In Madhya Pradesh we have a new cadre which is community health officer. They are basically nursing students, and they played an excellent role. They basically man our sub-health centers, which we call health and wellness centers also. Then we said that for pregnant women, we'll have special sessions where the CHO will lead, and they did a fabulous job. And I'm very happy to say that in the entire country, maximum number of pregnant women successfully vaccinated is again Madhya Pradesh. We factor for more than 24% of the national average of pregnant women in Madhya Pradesh. So that's how we tackled the gender issue also. And I think, like I said, our motto has always been that everybody who is eligible should get the shot, and that's how we work.
Fascinating story, madam. So one of the things that I'm very tempted to ask, after hearing you, is you spoke a lot about data, and you talked about, how data led to decisions that you took. So how comfortable were program officers with the digital data that, CoWIN generated? How comfortable were they with, the familiarization with CoWIN use and all of that?
I would say that initially whenever a new system is on board, there are teething troubles.
Sure.
So obviously Madhya Pradesh had its own share of teething troubles, but I am very grateful to the ministry at Government of India and the continuous support of our state government, our ACS Health, who was very categorical and clear that we will not have hybrid or two kinds of system. Reporting should always be what is on the portal. So if one district is saying that I have given that many shots, then it should be, the data should be reflected on the portal. Obviously, we did have, some pockets where the internet was an issue, and then there were also guidelines from the government that for people who do not have IDs, like homeless people, people who are on the streets, for them you can create special sessions, and there was a separate mechanism to do it. But whosoever we covered, we ensured that that data gets reflected on the CoWIN portal, and obviously we trained our manpower. We have a daily VC mechanism. Our DIOs always know that 6 p.m. MD NHM is going to review and regarding their issues, or if there is some problem or some planning that has to happen. So you're absolutely correct. Most of our decisions were led by data, and we ensured that we captured the right data and we captured it timely.
Wonderful. So I think, the audience will be very interested to hear a little bit more about the review mechanism, both at your level and then down to the district level, because for our polio program, for our measles program, and now for COVID, we do see that the review is a very important tool in terms of the performance. So would you please elaborate on that a little?
Always believed in that in governance, review is very, very important, and for a campaign as important as COVID vaccination, review actually happened at multiple levels. At the state level, we have a review mechanism which is led by the ACS, which deals mostly with policy matters, but then having said that, we also have the Chief Minister reviewing the COVID status almost during the pandemic daily, having at times even multiple sessions, and even when the situation was under control, and for vaccination almost twice a week. So our Chief Minister also believes in rigorous review, so he has done that. Our ACS reviews it periodically. And at the NHM level, because we have to deal with the day-to-day working, so we have a daily review mechanism. We have used our social media extensively. We have the groups of DIOs, we have the groups of CHOs, we have the CMHO civil surgeons on the groups, and we constantly, even when we have our Maha Abhiyan days, hourly data is shared. If we find that some district which can perform up to its potential, but during the past 1 hour has not performed, or rather we compare it with the previous day's data and is going slower by the previous day's data, we instantly, there's a touch, what is the problem. So we get to know that there might be rain, there might be some local issue because of which it has been affected, and then that leads us to fine tuning our approach. Then there and then we make a decision, okay, so this district has to do 2 hours more, or this district will wind up early and we will do a catch-up abhiyan 2 days later or the next day. So that sort of a review happens, instantaneous decision making happens, and our state immunization officer, apart from the reviews that I take, he at times keeps our DIOs and the officers on Zoom review or on social media review, on our NIC VC reviews, and we keep constantly hand holding them as well as reviewing them, because the motive is that the coverage should be there.
Right. So I have visited many states in India in order to look at the COVID vaccination and other. One unique thing that I saw in Madhya Pradesh is when I was coming upstairs, the control room that you have set up at NHM. That's something that I've not seen anywhere. It's almost like reminds me of the Second World War kind of movies that we see, that everyone's sitting with the phone. So would you like to elaborate on that a little bit? What's that?
So if you've just seen the NHM control room, I would advise you to go and visit the smart city control rooms which the districts run. They have a far more rigorous number of seats and number number of calls, and one person ends up, calling the general citizen to mobilize them. So we also have this. So if I say my second dose was due, I received messages, WhatsApp messages, and as well as calls from the district call center that it is due and you should go to this nearest center, and if I have a query, they reply to that. So one is that is being run. What we at the NHM command and control we do is we keep reviewing, like I said, the hourly progress, the weekly progress, where there is, say a vaccine wastage issue, even upload issue, some data discrepancy which is there. Nothing misses our eye, and we keep, seeing the data and do the data triangulation. We, if say some districts comes up and says no, we have exhausted, we can't do any more, and this is the only population we have. We pull up the migration data, we pull up the electoral voter list data, and we say there's still scope here in this village, in this block. So that is what we do at the control.
Excellent. One of the things that, in terms of vaccine hesitancy, what is the kind of vaccine hesitancy, what magnitude of that have you faced in the state?
Initial round obviously had this hesitancy and this fear, and I would say that it was equal everywhere. There was skepticism in the urban level, and there was hesitancy even in the tribal level. There was a lot of myths and rumors going around, and it took some time to clear that up. But I'm happy to share that one of the villages which got first, which came first in covering both the doses was a tribal village of Jhabua. When we a similar sort of documentation exercise when we did there, the Asha worker very proudly said that when I went first to convince the people and motivate the people for the vaccination, they said that no, this vaccine is very dangerous and it's harmful, and deaths happen because of that. And and then she said that what I did was I got myself vaccinated first, which was obviously the policy also. Sure. And then they went back and said that, see, now 1 month has lapsed and I am hale and hearty, I'm fine, so you all should come forward and do get vaccinated. And then that's how we dispelled the myths. So we did have our share of motivating people, convincing people, spreading the right information, but then I think we are past that stage. Now people understand the importance.
Absolutely. And my final question to you would be around partnerships, because such a massive program could not have happened without a very strong partnership, inter-government, within the intra-government, and also in terms of the private sector, non-governmental sector with the community. So can you just speak a little bit about how you did the partnership?
See, like I said, we've always had a people-centric approach, and we always believed in convergence. So even within the departments, we always have the intersectoral approach. So some of the departments who have supported us through and through, one is WCD, Women and Child Health Department, because the Anganwadi workers were instrumental in mobilizing the female population. Then we had the Education Department, who in their own innovative ways, mobilized people. We had the Rural Development Department, because we also have a very strong SHG movement in the state. So we had these groups of National Rural Livelihood Mission, who themselves, their families, as well as motivated people in the community. So apart from the government sector, wherein we leveraged almost all the departments, including police, including transportation, matlab some of the departments which are usually not brought into the picture for motivation, we used even those departments. Apart from that, from within the civil society, like I said, we extensively reached out to religious leaders of all religions, who in their temples, in their speeches, in their parts, in their azans, in their Gurbani, they have actually spread the message. Apart from from that, we also have a very healthy and robust system of a lot of developmental partners, be it WHO, UNICEF, and if I actually have to list out, it's a huge, but they played a very crucial, critical role. Some of them have even moved vaccine vans, helped us in mobilizing people in their own way. Some of them have picked up a few villages which were initially a very difficult villages to work with, and they adopted those villages and said that, okay, if you're having problem here, we'll stay, camp out and tackle those areas. So I would say that we've received 100% contribution from everybody. That's how we were able to do it.
And in fact, one other unique thing like the control room that I heard in Madhya Pradesh is around a crisis control group that was formed, which had a very high leadership. And so all of these are excellent examples. And I do hope, that you are documenting all of this, just not for this program, but for future programs. And also many states will learn from what you have done in this state. Allow me to end, Madam, with big congratulations to you and the state for this excellent performance. And this people-centric program that you have done is really something that exemplifies what public health should look like. Thank you very much for your time today.